Now I request Santhan to give a case report.
Case reports. Yeah, it's a very difficult act to follow, JP.
The screen.
But I'll try my best.
Board.
First time I met
Sachin?
JP was way back in 1982 in Velo, CMC Velo.
You're a lecturer. You're a lecturer.
Yes, lecturer. He was already a lecturer. I joined as lecturer. Probably he's 2 or 3 years older than me, not a lot. And that's the time I met him. And then I told him the time really flies.
I think Alexander was the head of ophthalmology, I think, that time.
Alex was there, and then he had gone to Australia. Ravi Thomas was the head.
No.
Now I believe in dying, so that I believe in living.
But I think one thing which Dr. Malay's thing brought, I wanted to say is one is to be truthful. He mentioned about God and truth on the apex, and the other is precision. So I always quote 5 P's: perfection, prayer, precision, and what are the other 2? I forgot my name. So I think it's important. Probably these workshops train us to think well, even to treat patients well, and if you don't even do a study, but at least to treat every patient well.
True. Now, I come to the point, case reports. When you say case reports, the first thing that goes through the mind of an editor or an associate editor of a journal would be, what do I gain by publishing this in my journal? Waste of space, does not improve the impact factor, generally does not improve, although we can improve significantly depending on what you publish, because impact factor is calculated on a number of factors. Whether you are aware how impact factor is calculated or not, I am not sure. So case reports usually do not add to the impact factor in a journal. So editor is not very pleased to publish it. So when you are writing case reports, you will say, why should I publish this? Nobody reads my case reports, or I also don't know what it is, and I also don't read. Why publish it? But then I'll tell you, they are very valuable and they are very good, and it makes you how to write real papers later on. When you start publishing proper case reports, you will definitely be able to write real published reports. Okay, they are valuable resources of new and unusual information that may lead to vital research. That's important. Let's look at the example. One of the 82, 83, 84, we used to see a lot of, in UK, at least from 84 onwards in UK, I used to see a lot of patients with Kaposi sarcoma and unidentified uveitis. We did not know the cause, etc. Now in retrospect, they were all due to HIV or AIDS, so-called earlier. They published a report in the Dermatological Journal about first of a case of multiple Kaposi sarcoma in a young homosexual male patient. Okay, humble case report. This is what they published. But later, a few years down the line, we know this is due to AIDS. So you don't disregard case report as useless. You should know what you are publishing, and you should know why you are publishing that, and in what it may contribute to the future research. That is important. That's why case reports are important, and that's why we have taken a decision in our editorial board to publish case reports as a rule. We do publish, we don't discourage people from publishing case reports. AJO, BJO and all, they don't even look at you if you send case reports. But that's a fact. Sometimes they do give a small slot in the letters to the editor, they give case reports, but generally they don't accept. But in IJO, we have taken a conscious decision to help the postgraduates also to publish case reports. And this again was case report. Everybody knows this thalidomide baby. But how did it start? Started as case report. A few people reported and they said, hey, I also have seen. That's how it came. For example, 4 years ago, we saw a number of cases of toxoplasmic chorioretinitis in newly born children, about 4-5 years ago. And we all were wondering what happened. And then Arvind, I talked to, I also go to Coimbatore, and there I used to see some pediatric cases. So I saw a lot of cases of toxoplasmic chorioretinitis. Arvind, people said they also have seen many chorioretinitis. We said, why this many in a short span of time? Then we traced it to contamination of flash flood river water in Kovai as the cause of this. Then JB is involved. There is a case published also by JB in that. See how case reports are trying to alert you to what is happening. Okay? So don't disregard case reports. That's my first thing. Now, you have understood why case report. Okay? Why is it important? Has it been convincingly answered why it should be known? Now let's look at how to write this case report. Okay, you know now it is important. So how to write a case report acceptable to an editor. Okay, and where to find guidelines for reporting, and why the editors are reluctant usually to accept your case reports. Now, the format of a case report. You can get number of help. See, the internet has made the life very simple. Complicated also, but simple. During our days when we were doing post-graduation, we were writing theses, we had to look through Index Medicus, Excerpta Medica Ophthalmologica, etc. Books, these big books with that much dust on it, you have to take it out and take out the papers and all. Now at the click of a button, you have all these answers. Okay? So if you go to this site, you will find all the excellent, what requirements are there by different journals for writing the case reports. It's a very good site. If you just, when you are sitting in the afternoon doing nothing, click and go through it and make a note of it. Okay, that's why I've given you the website. Okay, most journal, whatever journal is available, it will tell you what you accept case report. If they accept, what do their requirements. Okay, now what is a typical format of a case report? What should a case report contain? Okay, it should contain the title page. Okay, that is very simple. The title lists the author, the address, the methods of contact, etc. of the author. Then abstract, and then the keyword. Okay, now the abstract should be, I always say, the abstract should be like a bikini. Okay, it should be revealing enough to arouse interest. Okay, but at the same time, it should be brief enough to cover the important aspects of the case report. So our abstract should be like that. It should arouse curiosity in whoever reads it. Okay? And it should be definitely good enough to cover the important aspects in the title, in the paper. Okay? The abstract makes an impact on you when you read it. That is why one of the difficulties which I find when I review the papers from India, unfortunately, is that each fellow who sends the paper thinks in his mother tongue. It may be Oriya, Hindi, Tamil, anything. Translates mentally into English and then writes. Okay? So there is always a problem in conveying what they want to say. So I always say, think always in English. Even when how do you think in English? 3 4s are 12. You don't say. When you calculate mentally 3 into 4, each fellow 3 4 12, you will think. Hindi fellow 3 4 12. Then he will translate into English. That is the way the nature has designed your brain to be. So you have to make it unusual or unnatural by thinking in English.
People these days will take calculator, mobile phone and then say.
Correct. They never calculate. Okay, so the idea is to think in English and write. Then your thoughts will be better than if you think in your mother tongue. Unfortunately, our mother tongue is not English. It's an enforced language. So it's a language of the slaves. Okay? Your master language is your mother tongue. Okay? That is the problem I find when they present the papers for us. That's why I keep writing correct English and send it back. So they will say, what is wrong with this English, what I have written? So I have to correct it. If I keep telling them what is wrong, then I'll spend my time not in correcting paper but correcting English. Okay? So the abstract should be written specifically in good language. Take the help of a language instructor, it will help you definitely. Now the keywords. Now, morning you heard Vasumati saying mesh words, medical subject heading index. Now the keyword should be, to give you a small example, he said prickly eyes. Okay? Now prickly eye, you want to look in any of the PubMed, you will never find that word. Prickly eye is a common complaints by the patient. So what do you say? Foreign body sensation. You understand? That is the keyword. But if you write prickly eye, that is not a keyword at all. It will never get recognized by the mesh word. So your article will never ever be read. You understand the difference? So this is the same word, but it means different in English. Because English is a funny language. So the keywords which you choose must be carefully chosen. You go through a number of other previous case reports, go preferably English-speaking journals case reports, like BJO, AJO, any of those things, because they naturally think in English. Pick up those words and use them as your keywords. Don't use what you and I speak as normal English keywords. Okay? That makes a difference to your paper being accepted and also paper being quoted somewhere else. So it's called mesh subheading. That is the most important thing, is to use that. Now the introduction. In the opening statement, you present your topic which you will be discussing clearly, and the purpose of your case report. You want to say, I want to present this case report because I have urgently to present 3 papers because I have got promotion coming up soon. Okay, that's one of the reasons, but you will say, oh, I saw this interesting case, it's extremely interesting, and myself and my professor thought we must present this, so I am presenting. Whatever is your thought, you present it, but be precise in your presentation. Okay? Now, the information section, what is the introduction, what does it do? It will tell the reader who, just a casual look at your case report, he knows why you are presenting it and why is it important for him to read. If you don't tell that clearly, he will never read that. Okay, that is the introduction. Now, current case reports in what you have to do, patient, next is within the case report, body of the case report, you write the patient's presenting symptoms. Okay, why he came to you, what was his complaint, why you did certain investigations for that particular patient, and record carefully your images. The quality of your paper is dependent on the quality of your photographs. Okay, so any photograph which you have, make sure that it is of good quality. Even today I get some photo micrographs which I can't make out whether it's a white blood cell or it's a bone. They will send, you can see, put a large arrow mark which is larger than the photograph and say this is the white blood cell. See, these are all meaningless. You must do good photograph. That is because a lot of things we do chalta hai attitude. ठीक है यार, चलता है, Indian journal will accept. Okay, that attitude we don't condone or we do not encourage it also. Okay, what treatment was given and what treatment results and what was the follow-up. All these things should be clearly recorded. Now in the discussion part, okay, your discussion should be such that this method that you have used to diagnose, treat, etc. should be reproducible by an independent person. Okay? Now, what is the rationale for using a particular method of treatment? Why you have used that treatment? You should mention it clearly. All this, you may think it will take a long time. It will not. You don't need a lot of space. You really don't need pages and pages. I always used to say, when you do not have really matter to present, you do padding. You do padding. See, just like in real life also, you do padding. In padding, what you do, you take a lot of, in the discussion, 25 references, this fellow said that fellow said, but what are you saying that you don't say? Because you have nothing to say. So you will say, from 1930, that fellow saw this and he said this, and 45 he said, But what are you saying today in 2012 you don't say. You understand? This padding I can recognize in half a second. So the moment I see that, I cross out and say reject. So you clearly mention what is your concept and mention it there. So conclusion, it should be very clear again. Okay? Mention exactly what is the purpose of your case report and mention. Now once that you have noticed all these things, what does it come to you? Acknowledgement, reference page, etc. Forget. Tables should be very clearly marked. Photographs should be clearly marked. You see, I have never mentioned anything about statistical details here because case reports usually do not need that is why the value of case report comes down. Because it may be true for one person, it may not be true for another person because it's nowhere near the truth. But an unusual case can be really truthful. Okay? Now there are many sites where many guidelines which give you all this, but usually an editor is looking for these 6 or 7 points in a case report. There is unreported, unusual side effects, etc., unexpected or unusual presentations. Okay, these are the things which we look for. If it is there and if your image is good, we will definitely publish. We don't discount them. Now, once you have looked at, I just take only 20 seconds more. Once you have looked at these things, you realize that publishing paper is almost similar, isn't it? Like publishing a case report. So, practice case reports, you can definitely publish research papers. If you don't practice at all, then it's difficult. Okay, I think I will stop at that. If you have any questions, you are most welcome. Yes, sir. Please state your name and from? Yes, sir. Very good. I am glad to see different departments also here. Yeah. Yes.
Good only for your journal or?
No, that is for different journals give different regulations. We do not have, we normally don't take abstract for case reports. But some journals insist on case reports for the simple reason that when you go for PubMed, there are many things with no abstract available. You have noticed in the morning. But if you publish abstract, it is very useful.
And how will you decide a case like to fall under letter to the editor or as a whole page, as an article?
That is up to you. You decide and send us, then we will decide and tell you what we think it is. See, we make certain decisions after we have sent. You send it as case report. I may feel that this is enough as a letter to the editor. Because depending on my space constraint, I may say this is enough as a letter to the editor. Or I may say this is enough as a photo essay. So we'll ask you to adjust accordingly. Because the space constraint is also there.
And this criteria vary accordingly to other journals also?
Yes, not necessary. I gave you one earlier, this thing. No? Each journal has its own criteria for accepting. You send it to AJO, he will not even reply. Because he thinks it is waste of money even to send you by. He may send one reject post sometime after 3 months.
Okay.
So, it depends on the journal requisition requirements.
Thank you, sir.